It's an especially confusing time in America. The condition of President Trump, the lack of transparency, the Supreme Court nomination, and the impact of all of this on an election that's 29 days away. Last week, President Donald Trump and his wife, Melania Trump, tested positive for COVID-19. This is shortly after he hosted a Rose Garden ceremony on September 26th for announcing his US Supreme Court nomination, Amy Coney Barrett. Since that ceremony, where few were wearing masks, at least 11 attendees, including President Trump himself, have tested positive. Then we heard that Trump was doing well. Shortly after, he was hospitalized at the Walter Reed Medical Center. But the severity of Trump's illness remains unclear. The White House earlier said he had mild symptoms, but he has received extra oxygen twice because his oxygen levels dipped. He was also given the steroid dexamethasone, which is usually administered in severe cases and can also have psychiatric side effects. But then on Sunday, President Trump decided to go on a surprise car ride to greet supporters outside the hospital. He was wearing a mask, but it violated all quarantine protocol and put the Secret Service at risk. Dr. James Phillips, he's a doctor at the Walter Reed Medical Facility, he tweeted that presidential SUV is not only bulletproof but also hermetically sealed against chemical attack. The risk of COVID-19 transmission inside that car is as high as it gets outside of medical procedures. Meanwhile, Melania Trump, who has mild symptoms, remains isolated in the White House and said she isn't going to go meet Trump so that she doesn't put the staff who would drive her there at risk. And now, Trump has decided to return to the White House after 3 days. The White House says it's all medically cleared. Access to him will be severely restricted. Anyone who goes to meet him has to wear PPE. Then why not keep him at the hospital, which has a 6-room presidential suite including an ICU and state-of-the-art medical care? Is this about the optics of a president taken unwell after hosting a super spreader event for a pro-life conservative judge, then hospitalized with a disease he dismissed, availing the health care he won't provide for everyone, less than a month before the presidential elections? We didn't have to look far for an answer. The first thing he did after reaching the White House, a photo op where he removed his mask, folded it awkwardly, and stuffed it in his pocket, flashed thumbs up with both hands, and saluted for several seconds. You can see it. He's struggling to breathe normally. He did not appear to put his mask back on before walking into the residence. In a video, Trump said of the virus, "Don't let it dominate you. I knew there's danger to it, but I had to do it. Nobody that's a leader would not do what I did. And now I'm better. Maybe I'm immune. I don't know," he said. He's not. He then goes on to ask people to get out there while being careful and that the vaccines are coming momentarily. I'll stop here for now. My name is Pallavi Prasad. If you've been listening to this COVID update till the end, stay safe and thank you for your time.